how's it going? Susan Ruth here. Thanks for listening to this supplemental episode of Hey Human Podcast. I had a brief conversation with Dr. Rendi Murphree. She was on the show a couple weeks ago, and she's an epidemiologist, and I asked her if she would get on the horn with me here and update what she knows so far about what's going on, the latest news with the virus. So she was very kind to take some time out of her insanely busy schedule and do that. And here it is for us now. Thank you for listening. Please take care of each other. Stay home. I love you. Take care. And here we go. Dr. Rendi Murphree, welcome back to Hey Human.
Yes. Wish I could say it was good to be here, but things have gotten a little nutty, so what can we do?
They've gotten really kind of whack. It's interesting because the last time we talked, which was not very long ago at all, we were like, okay, wash your hands, don't make out with people, like use your Purell, don't be dumb, blah, blah, blah. And which is, I think still good advice, but suddenly things have just really shifted. So I wanted to get you back to talk about what's going on, because I think people are really scared and don't know what's happening and don't know who to trust.
I know. And, I know we talked before, but like things change, like not just every day, but multiple times a day. We'll see a press conference at 10 a.m., either from the feds or the state or a phone call. And then, by 4, it's something different. And so it makes it really, really difficult to plan. So, we have these like meetings that turn into just, like all day events, because, by the time we think we have our plan ready and we're ready to, do something, then something's changed and we have to kind of start over again.
Yeah, it does seem like every 4 or 5 hours, it's a whole new ball of wax. Is the virus itself changing? Is it mutating, or is it just that we're learning more about it, or is it just because it's spreading so quickly?
Yeah, it's not mutating that we know of, but we've entered what they call this acceleration phase. So, because, community transmission, because one person can, potentially infect 3 others, you get this rapid sort of, doubling and tripling of, people who might be infected. And so I think that's what we're starting to see. And again, all of these like aggressive, measures about recommending school closures and limiting the number of people for mass gatherings. Like last night, CDC said 50, no more than 50. And then today the president said no more than 10. And these things are tricky because we're just trying to kind of keep the number of cases every day below the threshold of sort of exceeding what our hospitals can take care of, right? Mm-hmm. And so if we had no intervention, you might see just a huge spike in just a couple of days in the number of cases where we'd overwhelm the hospitals and healthcare and we'd just be in a mess, right? We'd probably have more people die. But what we're trying to do is just sort of delay, and try to keep the number of cases below this line, this imaginary line of what the hospitals can handle. So, even if you're healthy and you think, there's no reason I should stay home. Like, please just follow the advice of healthcare and, follow the guidance of your officials and just, try to comply. And in the end, if we have a lower death rate than some other countries, then we'll be glad we did it and, had just, minor inconvenience for a couple of weeks, in the grand scheme of life.
You bring up a good point about overwhelming hospitals because there's only a certain amount of ICU beds, right, in America, and only a certain amount of respirators, I'm assuming, and...
Right. So I think ventilators is the thing that hospitals are worried about running out of. If they have, patients that have severe complications and they require ventilator support to breathe while they try to, fight the illness and recover from the illness, then, it puts the hospitals in a really tough situation of, having to potentially, triage or go to altered or crisis standards of care, that sort of thing. And nobody wants to do that. So And, we have an enormous strain on just supplies. So personal protective equipment, masks, gloves, eye protection, respirators or face masks are in short supply. Testing materials are in short supply. CDC's advised going from just a month ago or a couple weeks ago, they wanted you to draw blood or serum and do a nasal swab and an oral swab and maybe send sputum, and now they're sending just one swab. We need to conserve our swabs, so we're just going to do one swab per patient. And so, it's all about just trying to conserve materials so that we can hopefully have materials while we try to, keep this, this peak from exceeding what we currently can do at the healthcare system. So trying to keep it under this, trying to, shorten the curve. We flatten the curve.
Flatten the curve.
Flatten the curve. Yeah.
And a couple of weeks ago, we said, we think it's a lot like, we talked about, it's a lot like a flu, but this is spreading, seems faster than a flu.
Yeah. So it does seem to have a transmissibility or infectiousness seems to be more than flu. So, things are changing all the time. But the figure I saw most recently was one coronavirus case can potentially spread it to 3 others. And that's, 1.5 or 2 times more than flu. And then also, I read a recent editorial by Tom Frieden, who, as you probably know, since you're a CDC fan, is a former director of CDC. And he wrote a really good sort of editorial or article to help us kind of understand why the strong reaction is necessary. And he helped me understand that, typically from, complications from for influenza are like pneumonia. But it looks like the severe complications from coronavirus is what we call acute respiratory distress syndrome, which is a totally different pathology from pneumonia, and I think more difficult to deal with. So still we see, the death rate in the U.S. is still, at 3-4, under 5%. So we're still seeing, 95, 96% of people who get infected or survive. But the folks that are in that highest risk group, elderly, people with immunocompromising condition, folks with comorbidities, or if you're older and you have comorbidities, you're at much greater risk of developing complications. And those are the people we really want right now nationwide, heeding the advice to stay away from congregate settings, social distance, wash your hands, stay at home, those kinds of things.
It is weird to see all these people saying, screw it, I'm going to go party and I'm fine. And I think, you have no idea who you may be infecting if you're asymptomatic. And I think about, too, that we've had
That's true.
several hundred, if not thousands of years to adapt to the flus that we see, and let alone, and then, maybe a couple decades to adapt to the newer flus. But since nobody has an adaptation immunity to this within their own body, I imagine it makes it that much harder to fight.
Right. And, we're starting to see, we've been going under this very sort of clear guidance of your infection is between 2 and 4, the incubation period is between 2 to 14 days. And you probably are, you're not spreading if you don't have symptoms. And I'm starting to hear sort of, national figures say, we may be seeing, contagion before symptoms, or it might be that people with mild symptoms are contagious and they just don't recognize that they're symptomatic, or maybe there is a role in spread with kids that we're not recognizing because kids, are not having very severe symptoms. So, for example, I think that CDC lowered the fever definition for folks who are older because they may not be having fever that reaches that 100.4, and maybe we need to think about, fever being defined as 99.5 and greater. I mean, that's a very low, fever threshold. So,
Sure.
We're learning all the time and things are changing, and so we just have to sort of try to adapt with the change and just, do the best we can. And again, that's why these, potentially asymptomatic infections, potentially mild symptoms, that's why we need people who think they're healthy and don't, think they have the best immune system in the world to really heed the advice of what public health is trying to implement to try to stop, community, widespread transmission.
And for people who are younger, who it's still leaving some scar tissue behind in lungs and things, from what I understand. And I'm trying to keep up with all the research, but my God, it's changing so rapidly.
It's impossible. Yeah, it's impossible. I had heard that there's some different findings on CT scan that might help, identify between influenza and coronavirus infection, but that's not diagnostic at this point. So that's about all I know.
We'll probably learn everything about this in about a year or two, right?
Exactly. Yeah, there will be lots and lots and lots of science and, papers and information that we learn once we're further, down the road or get sort of ahead of it.
I look forward to reading your book on it also. And the other thing that I heard as well was that if you've had it already, you can actually get it again. And again, that thing about your body having an immunity, that they're seeing people getting sick with it more than once.
Yeah, you're probably more read up on that than I am, Susan. Just that was something that came up really early on based on some science coming from, other countries.
Yeah.
There are some papers that have been published in the, U.S. literature, some things in MMWR, and I think in the Journal of the American Medical Association, but I've not read the details on those. So, sorry.
No, it's okay.
More of an expert on that than I am at this point.
I don't think anyone's an expert at this point, but what do you see as far as what's going to come next? I just read a few minutes ago that San Francisco is doing a lockdown. I know that places in New York, like New Rochelle, did a lockdown. I mean, things are going to get worse before they're better, I guess.
Yeah, hopefully these, dramatic restrictions of movement are going to, keep it from getting to the worst case scenario, right? Like, it's always hard to judge those things when you're in the middle of the event. I mean, the president said today that they're not considering, nationwide curfews and restrictions and that sort of thing. But as you have just noted, that there are state and local jurisdictions that are implementing those kinds of things to try to keep, widespread community transmission from happening in their jurisdictions. And that's certainly within their purview. And those decisions are made based on sort of the local, what we call the local epidemiology of what's happening. Is it widespread? What's it look like? How much capacity do you have, right? How many tests can you run? So there's a lot that goes into play at the local level when those decisions are made about, implementing those rather, austere and unprecedented in our lifetime recommendation about limiting movement and travel and that sort of thing.
Let's say if we do, sorry, I didn't mean to interrupt you there.
No, I was just going to say how I honestly thought that a pandemic, big influenza would probably not happen in my lifetime. And so I'm having to eat those words to some degree because this is definitely sort of a, once in a lifetime event.
Yeah, it's nuts. Although, again, you and I have had plenty of conversations that said the pandemic was coming, but I don't think either of us had any concept that it would be like this.
Yeah, honestly, we've talked about it and we've hypothesized and we've role played and we've simulated and all of that, right? And so I think that there have been exercises where we have practiced, taking it to this level over the course of maybe a 24-hour exercise, right, where we're just talking about it. But when it comes to taking those written plans and those, practice scenarios and really seeing it happen, it's just not anything that I think anyone expected. So, but the important thing to remember are these mitigation, closing schools, restricting travel, all of those things have been discussed for a really long time. Mm-hmm. I think that I mean, I'm shocked that it's actually here that we're having to do that.
Well, and that's the thing too, is to understand and I don't mean this in a derogatory way, the layman that's experiencing this, that people don't understand that y'all have been running scenarios like this forever, and this is how you stop the spread of something.
Right. So, papers that have been written, conferences that have been held to sort of demonstrate the plausibility of these kinds of things, never get too much press attention. They just kind of, get filed away. They're not that sexy when we're first doing it. But then, yes. So most people don't understand that, there have been scientists and public health officials working on these kinds of things for a really long time.
Decades.
Even before 10 years ago, before pandemic H1N1.
Yeah.
So
I've read papers written in the 50s that talk about this stuff. So I think they've been aware of this sort of idea for a long time.
Yeah, absolutely. There's this great comparison, I think, from Philadelphia and maybe someplace in Missouri back during 1918, where one town didn't do anything and the other one leaned really far forward, and the number of deaths that were prevented is just, so remarkable. So, it's not just that we're kind of, grasping things out of the air. Hey, what can we do? These are things that are based on history and data and science and modeling and all of those things.
Meanwhile, frantically, a vaccine is many people I know are trying to figure out how that will happen, because otherwise, even if we flatten, will it just resurge again without a vaccine? Is that a possibility?
Yeah. Well, it's possible that it becomes just sort of part of our ecology, right? The way West Nile virus is now, the way H1N1 is now. So it's possible that after we have this sort of, however long it's going to be, few months or maybe a year, until it, until the population sort of, people use this term, sort of burns through the population. But anyway, until we have seen it everywhere, right, and we start to build some community immunity through, infection and exposure. I mean, it's possible that it could become part of seasonal, influenza season every year, where we see all kinds of things other than flu circulating. We have milder coronaviruses that circulate every year. We have rhinovirus, enterovirus, parainfluenza, lots of different, respiratory viruses that are part of the seasonal influenza nasty cocktail, right? So
yeah.
It's possible that after we have it kind of, move through the entire population in the U.S., that we may see it sort of settle in and just be sort of part of our natural ecology.
And this is now officially a SARS coronavirus, right? Meaning that it's respiratory.
Well, so this actually happened probably about a month ago when they decided to change the name of the disease to COVID-19. The International Science muckety-muck, I don't know what the name of it is, decided to call the virus SARS CoV-2. But to try to avoid alarm with comparison to SARS back in the day, they've sort of, CDC has sort of, and everyone has sort of downplayed the fact that in the taxonomy, they're calling it SARS-CoV-2, but most of the public health agencies, just to make sure there's no confusion, is calling it the virus that causes COVID-19.
Okay.
Right? Yeah, so that's just, it's that SARS terminology is just sort of for scientists and taxonomists and that sort of thing.
All right. Well, I know you are extremely busy. I just want to ask you one last question. I really appreciate your time, Rendi. You're the best. What should people do? Should they start to feel... Now, obviously, the common cold is still out there. It's going to be allergy season. There's all sorts of things that make people cough and wheeze. So any advice to people that are just hoping not to get sick?
Yeah, so, we've been telling people to sort of, prepare yourself, prepare your home, right? Be ready to stay at home for a few weeks, if you have to. And it looks like lots and lots of people are going to be asked to do that. Yeah. Stay at home if you're sick. Know where to find local information. I heard a super cool thing from CDC today that they've been working from Google to make sure that, like, from wherever you are, from your IP address, when you Google COVID, it's going to bring up your state health department, because that's where you're going to have the most local, the most accurate local information. So, you also want to, people who are at highest risk, that are vulnerable to complication, like you are the ones that, the most need to be protecting yourself and your family. So yeah.
Okay.
Just
I appreciate the update, Rendi. Please stay well yourself. I know you're moving about trying to get information out, and that puts you in a vulnerable position. So please stay safe.
Okay, we'll do it, Susan.
Thank you.
Take care.
All right, bye-bye.
Okay.
Thank you.
Bye.